Hi guys, today is Saturday, March 23rd. I'm coming to you with information about my pre-op appointment that I had yesterday at Kaiser in Oakland. I don't know if I told you guys, but I have a surgery date of April 2nd, which is a Tuesday. So yeah, that was really good news. I'm sorry I don't seem so upbeat today. I'm feeling a little weak. I didn't sleep too good last night, and I'm kind of getting crampy feelings, and today's just been kind of an off day, which is why I look bananas. And I'm kind of cold. And my house is 70 degrees. But I'm feeling a little chilly. Probably because I'm so thin, but anyway. So I went to the hospital in Kaiser, Oakland, and was really impressed with it. It's a really big hospital. It's been remodeled. It's really nice looking. I was really impressed. Any of you who are familiar with Oakland, specifically Highland Hospital, that's kind of the vision that I had in my head of where I would be going, and I was pleasantly surprised. I have never been happier to be wrong. So I went there for my appointment. I first met with Marina, who gave me this package. I'm going to go over with you the stuff that's inside. I got this folder. Okay, so there are some sterile wipes, non-sterile, whatever. You can read what's on there. The first thing I went over was this one paper here. And basically, it's your surgery preparation. The first side that we addressed, though, was this side. And it says, before surgery, beginning a whole week before my surgery, do not shave or wax my legs, underarms, or the area of my body where they'll be operating. That's going to be really... I'm glad I'm not a super hairy person, but not shaving, especially your pits. The night before, it says to shower or bathe and shampoo your hair. Then I need to wait 1 hour and then use the 4, 2 in each, antiseptic wipes provided. It says gently and thoroughly wipe, don't scrub your body. In the numbered order on the diagram to the right, then let your skin air dry. Don't wash it off or use any lotions, moisturizers, or cosmetics. It says my skin may feel sticky, slightly itchy, or have some redness after applying. If the symptoms continue, stop using the wipes and rinse your skin. And then dress in clean nightwear. This is the order that it goes in. Wipe neck, chest, arms, and armpits with one of them. Second one, wipe abdomen, including folds. So if you're like me and you've lost a bunch of weight and your skin is folding, you need to lift your skin and wipe it. Including folds, both hips and groin, but avoid your delicate areas. The third one, wipe the front and the back of your legs, and then yeah, front and back of your legs. And then the fourth one, just here, you wipe both wipe your back, then wipe your butt cheeks, the outside. Don't go all up in your crack. And then the day of surgery, do not shave or wax your legs, underarms, or the area of your body where will operate. Do not use lotions, moisturizers, or cosmetics. Wear clean underwear and clothing. I don't think anyone would actually wear dirty underwear. And this next part here, I'm just going to read it because I'm okay with reading backwards, but it says what to eat and drink. You may eat food up until 8 hours before your scheduled arrival time unless otherwise directed by your surgeon. I got this carbohydrate drink called Clear Fast, and what it says here is it safely hydrates and nourishes before anesthesia. And it's a white grape flavor, and it helps with recovery after anesthesia. If you're not a diabetic, you can drink this whole thing. If you are a diabetic, because you won't be taking your diabetes medication, you can only drink half of it, which is 6 ounces, I believe. Yeah, 6 ounces. So start drinking the carbohydrate drink recommended by your surgeon 2 hours before your scheduled arrival time, and finish it within 15 minutes. So basically slam that thing. You may drink other clear liquids up until 2 hours before your scheduled arrival time, like water, clear apple juice, and tea, or coffee without milk or milk substitutes. Do not drink orange juice. Brush and floss your teeth 2 to 3 times each day. Quit smoking tobacco. Follow skin cleaning directions, and use the incentive spirometer to exercise your lungs and prevent pneumonia. Practice before and continue to use after surgery until you are up and moving for most of the day. And this is that spirometer, whatever. I didn't get one of those though, so I don't know how they want me to practice before. Whatever. In the folder, there's also an enhanced recovery, goes over the surgery, get up, get moving, so pain control and activity, eating and drinking, tobacco, mouth and skin care, other steps and treatments. And frequently asked questions, there's that. Important phone numbers for my surgery, they're all listed on this page here. Put this sheet back in here. And then there was this prepare for surgery pamphlet in English and Spanish. I haven't read through this yet, but you know, it looks kind of stupid simple. So yeah, it's just the same thing to it. So I'll probably read it tonight or something. But that was in my first package. I'm going to put these back in the bag. Then I went over to the other side, which is, I believe it was like admitting, even though I wasn't, even though I wasn't being admitted. And I met with John, who asked me a few questions. Really fun, really nice guy. We actually had my sister went in with me to that appointment. I was hoping my daughter would want to, but apparently it wasn't important enough. But I guess that's a whole nother story, which may be attributing to my demeanor. So after I talked to John, he told me I was going to meet with another nurse named Renee, and she gave me this. important surgery procedure information. And basically she told me that on March 28th around 1 o'clock I should be getting a call letting me know what time my surgery is going to be, because I know the date but I don't know the time. This stuff basically is a reiteration of what was in there about eating the clear liquids. The only medication I can take before my surgery is my thyroid medication, which is my levothyroxine. I usually take my high blood pressure pill at night, so that's not going to interfere. I can take it the night before. Oh, hi. Let's just fall. Let's just fall over. Sorry. I can't wear jewelry. I don't have any body piercings aside from, you know, the ears. But I'm supposed to remove all of my jewelry and body piercings and leave my valuables at home, bring my Kaiser card, my picture ID. If I have an advance directive, which I presently do not, but I do have something to fill out over there, I need to bring it. You must have an adult bring you home after surgery. If you use paratransit or a taxi, please don't shave. What time should I arrive on surgery? They're going to let me know 3 business days before my surgery, and if they don't call me, there's a number right here that I need to call to let them know that I didn't receive a call. And there's like a map of the hospital in the back. Then after that, I met with a doctor who went over all of my current medications with me. She also, Renee and the doctor also instructed me not to take my multivitamins or any herbal supplements for an entire week before my surgery, just to avoid any kind of interactions that may take place. So I won't be taking my multivitamin or my hair, skin, and nails, or my turmeric or L-glutamine, milk thistle, just the stuff that I was taking to help my body recover from radiation. The doctor gave me this paperwork full of information, basically a lot of the stuff that we had gone over. I can't take aspirin for 7 days. I can't take any non-steroidal anti-inflammatory meds like ibuprofen, Motrin, Advil, Aleve, or naproxen. But I can take Tylenol if I need, you know, headache medication or if I'm feeling a little poopy. And oh, sweet mother of God. I'm sorry. I'm going to have to hold this. Remove any piercing. Basically, all of this is like the same stuff that I went over twice now. They gave me directions on how to get there, and I never got there. I'm being an asshole. I learned that I had a bunch of questions, like, am I going to have to share a room? And I found out I won't. I will have my own private suite, they call it. I didn't get to see it, but she told me that I'll have a day bed in there so that one of my family members can stay the night with me. Obviously not my daughter, but I asked if I was going to get staples or stitches, and I believe they sealed the incision with like a liquid stitch, and then they put that Tegaderm on top of it to keep it sterile and nice and clean. I won't be able to take a shower. I'm gonna have to, again, I'm gonna have to sponge bathe for, I believe it's like an entire month after my surgery. Again, they can't tell me exactly what's going to be done. If you look up a Whipple procedure, there are some standards about it. Everybody is different. And I kind of respect the fact that he doesn't want to tell me, okay, we're going to do this, and then he opens me up and finds different things going on. And has to do something differently, and then when I wake up, he's got to tell me, oh, well, you know, we had to do this instead, blah, blah, blah. So I'm honestly completely okay with that. The doctor that I have was highly regarded, is highly regarded at this hospital, because I kind of asked around. I like him. I email him, and for him being a busy surgeon, he emails me right back, and, you know, also continues to tell me, if you have any questions or anything else, just, you know, email me and I'll answer your questions, which I completely appreciate. He's a busy man. He does about 52 of these surgeries a year. So, and he's a pancreatic specialist. So I feel great about my surgeon. I feel really good about the hospital. Still a little scared, but less scared than I was a few days ago. I hope my volume on this is okay. I know I've been having some issues with the volume. Oh, you guys probably noticed I suddenly have long nails. I decided to do my nails, and then I went in for my doctor's appointment, and they're like, oh, you're going to need to cut your nails off. They're clear. A pulse oximeter, okay. Back in 1988, sorry, yeah, 1988, 89, I used to work for Nelcor. Nelcor is the first company that invented the pulse oximeter. Okay, that's a pulse oximeter is that little thing that clips like onto your finger and tracks the oxygen in your blood. Okay, it could see through clear gel. I understand they don't want them this long. I am cutting them down, and I am not cutting them off. So I actually may leave one completely empty, just so they'll have a finger to put the pulse oximeter on. But it's going to read straight through the clear gel. As long as it's not a color, it should be fine. I asked if I could bring my bedroom slippers, because I intend on walking as soon as I possibly can, because I understand that helps your digestive system when you walk, and I think that's going to be a plus for me. She told me I don't need it because, you know, you get those funky socks, but I'm going to pack them anyway. When my mom was at Stanford, she wasn't allowed to wear underwear for the first few days after her surgery. I asked, can I wear, you know, the panties? She's like, oh yeah. And I'm not down with the whole net looking things they loan you where you look like you have fishnets on your booty. I'm cool with that. I'll bring my own pennies. You know, they said, oh, you know, we provide you with toothpaste and mouthwash, but if you want to bring your own, I'll be bringing my own. I've already purchased like 2 word search books in case I get bored, and I bought a charging hub so that I could charge this iPad and my iPhone and my tablet, because I'm probably going to be doing a bunch of research online while I'm there. I might be on Facebook. I'm definitely going to, I'm going to have my own room, so I'll be able to record and not disturb anyone. So after the surgery, I'm probably going to ask one of my kids or my sister to videotape me with my iPhone so that I could share all of it as much as I can. It's been wild. I heard from my doctor, my surgeon on the 19th, who told me we were definitely going forward with the surgery. And 2 days later, he called me back with the surgical date, which was essentially 2 weeks later. He's really on it. He doesn't want, while the radiation is beating up whatever is in there, he wants to get in there and get that tumor out and get me back to good health. Presently, there's always a chance, and actually it's a 70 to 80% chance of recurrence with pancreatic cancer, but right now I'm not going to focus on that. I'm going to focus on getting rid of this, getting better, and then working on preventative measures to keep the cancer away. Eating more vegetables, keeping my body in an alkaline environment, just doing what I can to keep it away. I'm trying to think if there was anything else. Oh, my last surgeries, I had a hysterectomy in 2016, and I had another surgery that I'm not going to go into details about because it's just, it doesn't matter. I had another surgery in 2017 in June, and in both of those surgeries, I went into bradycardia, and what that is a low heart rate. Now, my heart rate a lot of times when I'm sitting resting is like, sometimes it'll go like 58 beats per minute, sometimes it's 54, but I do walk often. I didn't today though, and I suck for that. But my heart seems to be fine. When it first started doing that, I went in for the whole battery of the stress test, the EKG, the echocardiogram, and I came out fine. When they did the stress test, I'm kind of one of those people that if you give me a challenge, challenge accepted. So they wanted me to go a certain level on the machine, and then a certain time, and if I could go past that time, they would get a better rate. So I'm like, oh, challenge accepted. I want the best rate possible. And the longer that I stayed on there, the tech that was running the test was like, oh yeah, you're fine, your heart's great, because I was really pushing it. I was breathing like a savage at the end of it, but they're trying to talk to me, and I'm like, really? I'm trying to breathe. Can I breathe? But it was funny. During that test, laughed a lot. But back to the point, they're going to do an EKG on me on Monday. I got my lab work done Friday morning. I was like on everything. I'm like they gave me a few different dates for the pre-op. I took the next day. I talked to them Thursday. I was there Friday. Got my labs done Friday morning. I got the labs back, I believe most of them, if not all. The only one that looked a little off was the albumin. I'm low, which tells me I need to up my protein intake, so I'm going to start drinking my BioTrust protein shakes. It has 24 grams of protein, and it's low carb, so it kind of like regulates your sugar, so you don't have to worry about a spike if you're diabetic. Their flavors are great. Sorry to be a commercial about it. I don't get any kickbacks. I just really enjoy this protein shake. It's not grainy. It's super tasty. It's expensive, but if you buy it in bulk, it's easier. And if you're going through pancreatic cancer, you're going to need protein, so buying in bulk is a really good idea. There's peach, mango, strawberry, banana, milk, chocolate, vanilla cream. They now have peanut butter and chocolate. Hello. And cafe mocha. And those two I want to get. I'll probably order those. So I'm almost out of my milk chocolate. Mango, peach. I love mango, and I love peach, but it's okay. Strawberry banana is good. Throw a little like almond butter in there with it, and bam, got a really excellent protein shake. I have a little soreness right now. So here's something. My blood test that I got back, usually when your pancreas is having like pancreatic flares or acute pancreatitis, your lipase is like off. Mine's pretty normal. So whatever's going on in here with those pains that I was having, knocking on wood. Today's day 5 without a flare. And every time I feel a little pain, I'm like, oh God, please don't let it happen, because they hurt so bad. But 5 days. I think that's it, guys. For this next couple weeks, before the surgery, I'm going to be concentrating on getting my house, organized. I have currently like a clothes mess in the front of my bed, because I'm trying to get rid of my clothes that don't fit me anymore, and I'm having one of those, I want to hang on to it because of emotional shit. So I'm going to try to get through that in the next couple days. I'm going to redo my bathroom, just because. And then my office right now is a disaster area. I'm hoping that I can take an online class during my recuperation. So I want to get my office cleaned up and organized so that when I go in there I don't feel overwhelmed. So hopefully I can get that done. My kitchen, I started on it already. And it's almost together. There's like a few things that I need to address. And I wanted to clean the backyard. I know that sounds really retarded because, I mean, my reasoning for that is I have a pool in my backyard, and while I am not going to be able to get in the pool or swim, I do like sitting in the sun next to the waterfall and just listening to the water run. That's really soothing to me. And we have a jacuzzi too, so if I'm able to put my legs or my feet in there, I'll do that for soothing or whatever. And my daughter's dog is out there. He's a Siberian Husky. His name is Ghost. And I love the shit out of that dog. He's kind of a pain in my ass, but he's got the best personality. And I firmly believe that being around animals helps with your blood pressure, and they give you happiness, So if I could, go out there and hang out with him. He talks to me like he's speaking English. He thinks he's human. And he's a little treasure. He really is. So if I could relax outside and spend time with him, I'll be happy. I think it's about to hit the 30-minute mark, so I'm going to close. If you have any questions, just leave them below, and thank you again for tuning in. I might make another one because I've been asked some questions about where the tumor is and how big it is, so I might come back with that. Okay? Thanks, guys. Bye.